Well, March is Colon Cancer Awareness Month, and we want to take some time to talk about why it's important to raise awareness and remind our viewers to take steps to protect yourself and your family. This morning, we want to welcome Dr. Brent Welch with Gastrointestinal Associates of Northeast Tennessee. Dr. Welch, good to have you on the show.
Thank you. Thank you.
I see the bright blue, and of course, that's the color to really raise awareness, and this is a crucial month to get the word out about how important screening is.
Well, it is, and we're thankful for the opportunity to come on your show and talk about it.
Well, let's talk a little bit about colon cancer and some of the numbers and what you're seeing and why this screening is so important.
Well, colon cancer is the second leading cause of cancer death in the United States, and there are over 50,000 deaths each year. And the sad thing is it's largely preventable. Studies show that over half of those deaths could be prevented if patients would simply have some type of screening test and an early detection of their cancer when it could be cured.
And one of the things you always hear is, but I don't have any symptoms. And that's one of those that's it really hinders, because you still need to get out there and get that important screening. Absolutely.
That's the scary thing about colon cancer. It's a silent killer. Patients don't have symptoms with colon cancer until it's pretty far advanced. And so if they wait till they have a pain or pass blood or have other symptoms, oftentimes at that point it may be too late to cure, or at least it may require a surgical procedure to cure. Whereas if they have a colonoscopy in an early in a screening situation and have polyps, which is how we think colon cancer starts, found and removed, we can greatly reduce their chance of getting colon cancer.
And that's really the best news out there, is that while you're in there with the procedure, if they do have something, you guys take care of it right then and there.
Exactly. That's the whole point of colonoscopy. Is colon cancer starts off as a polyp or a growth that a person can have and not know it. And so we, with colonoscopy, look for those polyps, find them, remove them, and therefore prevent colon cancer.
And Dr. Welch, at what age do you think that people should be getting that important screening?
Well, up until recently, the guidelines always said age 50. However, now many people recommend age 45 to begin screening, and certainly it's recommended at age 45 for African Americans and for anyone with a family history of colon cancer.
Okay, so definitely want to watch those numbers. And then how often should you be having that screening after that age?
Well, it depends upon the findings. If a person has a normal colonoscopy, it's recommended they have it every 10 years. If they have polyps on their examination, or if they have a family history of colon cancer, then it may be every 5 years or perhaps even every 3 years.
And when it comes to screening, are there different types and disadvantages and advantages to those types?
There are, and we mentioned colonoscopy first because we think it's the best screening test. However, there are other options that are available. There are certainly tests that check for the presence of microscopic blood in the stool, and then a new test that I get asked about by my patients frequently called Cologuard, which is a test to check stool for DNA, which may represent a tumor in the colon. And then there's an x-ray test called CT colonography, which is an x-ray examination of the colon. And those are certainly all reasonable alternatives. And we have a saying in gastroenterology, the best test is the one that gets done. So if it comes down to a person not wanting to have a colonoscopy but willing to have another test, that's certainly better than not doing anything.
Better than nothing at all. But still, we say the stigma. It's always hard to say I'm getting that colonoscopy, but really that is worse than the actual procedure.
Well, it is, and we always say that the test itself is painless, it's quick and easy. We do it as an outpatient in our office. It takes 30 minutes. They're in and out quickly. But the preparation process is the part that folks complain about, and of course it's important to clean out the colon so that if there's a polyp there we can see it and remove it, and so in my mind it's a small price to pay to reduce the risk of colon cancer. And I always tell patients it's a win-win, because if you have the examination and we find something, you're going to be glad that you had it and we found it and got it taken care of, and if your colonoscopy is normal, then it's something you don't have to worry about for 10 years.
10 years. Very well said. Doctor,
Thank
great
you.
to have you on the show.
Thank you.
We'll look forward to seeing you for a run for the buns coming
All right.
up in April.
Thank you.
For more information and to schedule your screening, you can always call their office right there at the number on your screen right in Johnson City, or you can also check out that website for more information.